Bismillahirrahmanirrahim. Assalamu alaikum dear viewers. I am Professor Dr. Muhammad Usman, and in today's short video we will learn about lung compliance, which is a very important concept regarding the physiology of respiration. So by definition, lung compliance means change in the volume of the lungs for a unit change in transpulmonary pressure. It simply means that how much the volume of the lungs changes when transpulmonary pressure inside the lungs is changed. Loosely we can say that compliance is measure of expansibility or distensibility of the lungs. The formula of the lung compliance is C is equal to delta V over delta P, where C is lung compliance, delta V is change in volume and delta V is change in pressure. Now the normal compliance of lungs is about 200 milliliter per centimeter of water. It means that when the transpulmonary pressure is changed by 1 centimeter of water, then the lung volume will change by 200 milliliter after about 10 to 20 seconds. Now the compliance of lungs and thorax, that is which means that the lungs plus the chest wall, it is about half of the compliance of the lungs alone. So compliance of the lungs and chest wall together, it is about 110 milliliter per centimeter of water. So this is the famous compliance diagram. On the x axis we have pressure and on the y axis we have volume. Okay. So you can see that at the beginning of the inspiration the pressure is about -5 centimeter of water, and as the inspiration proceeds the pressure becomes more and more negative. Okay. And when the pleural pressure becomes more negative, the lung volume it increases. So when the pressure becomes -7.5 centimeter, then we have breathed about 500 ml of air or 0.5 liter of the air. Okay. So in one complete inspiration we have breathed about 0.5 liter or 500 ml of air, which is called tidal volume. Then during expiration the reverse happen, the pleural pressure it becomes less negative, and due to that expiration occurs and air is blown out. So this curve it is called inspiratory compliance curve, and this curve which shows expiration it is called expiratory compliance curve. Together these two curves they form the compliance diagram. Now there are two types of compliance, that is static compliance and dynamic compliance. Static compliance is measured during breath holding, while the dynamic compliance is measured during normal regular breathing. In normal individuals both of these are equal. Now compliance is inverse of elastance. Okay. What is elastance? Elastance is basically the tendency of the lungs to return to their initial size after distension. Okay. It is the tendency of the lungs to return to their initial size after distension. So it is the inverse of compliance, which is a measure of expansibility or distensibility of the lungs. Now elastance of the respiratory system is equal to elastance of the lungs and elastance of the chest wall. Okay. Elastance of the respiratory system is equal to elastance of the lungs and elastance of the chest wall. Elastance of the chest wall remains almost constant, while if we talk about the elastance of the lungs, it depends upon two things. Number one, elastic forces from the lung tissue, which means that there are elastin and collagen tissue in the lungs which oppose the lung compliance, and secondly it is caused by surface tension. It is caused by surface tension. About 1/3 of the elastance is caused by the lung tissue, that is by elastin and collagen present in the lungs, and about 2/3 of the elastance of the lungs it is caused by surface tension. Now where is the surface tension? Surface tension is present on the surface of the fluid lining the walls of the alveoli. We know that a fluid it lines the walls of the alveoli, and on the surface of the fluid this surface tension is present, and this surface tension it opposes lung compliance or expansibility of the lungs. Now there are certain factors which increase and decrease the lung compliance. First of all, we will discuss the factors which increase the lung compliance. So there is surfactant. Okay, surfactant is a surface tension lowering agent which is present at the surface of the fluid lining the walls of the alveoli. It is secreted by these type 2 pneumocytes, and this surfactant it forms a layer on the surface of the fluid lining the walls of the alveoli, and it serves to decrease the surface tension. It keeps the surface tension in check. Then there are certain conditions like emphysema, it is a lung disease, and also in old age the compliance of the lungs increases, because in both of these conditions there is loss of elastic tissue from the lungs, and we know that elastic tissue, it is an opposing force to the lung compliance. So when the elastic tissue reduces in emphysema and in old age, the compliance of the lungs is increased. Emphysema, as I told you, it is a disease of the respiratory system, and the most common cause of the emphysema is smoking. So due to smoking, the emphysema develops, and there is loss of alveolar walls, destruction of the alveolar walls with the loss of elastic tissue from the lungs. Then there are certain factors which decrease the lung compliance. Now, can you name any physiological factor which decreases the lung compliance? Yes, of course, it is the surface tension present at the surface of the fluid lining the walls of the alveoli. This surface tension of this fluid, it naturally tends to decrease the lung compliance. Then there are certain pathological conditions which reduce the lung compliance, like, yes, this is tuberculosis, then fibrosis, any condition, any chronic infection of the lung which causes pulmonary fibrosis, it will reduce the lung compliance, and then finally atelectasis or lung collapse. So all these conditions, that is tuberculosis, lung fibrosis and atelectasis, they tend to decrease the lung compliance. Hope you would have understood the concept of lung compliance, and if it is so, please subscribe to this channel. Thank you for watching. Stay blessed. Allah Hafiz.